With these visual snow patients, there were just lots of questions. And the questions were, can you help me based on my symptoms? And I just didn't think that, based on the experience that I had at the time, could I honestly answer all those questions for all these patients with various levels of symptomology. Charles in Texas had similar experiences with patients, and it was again through VSI, the Visual Snow Initiative, and their amazing collaborative network that brought him and I together to have a discussion about whether there's room for us to talk and develop. And through our discussions, it made it clear that the best method for us to answer questions was really through a research project. The study officially began in November of 2020. The visual snow patients that have come to my office have been quite debilitated by the condition. So aside from having symptoms of snowy vision, double vision, sometimes they say tinnitus, the standard symptoms that most VSS patients complain about, many of them had stopped working, had retreated from their life, had not been able to go out, enjoy their family, enjoy their friends. I've been able to really recover most patients back to typical living again. They've resumed their jobs, or they've resumed their life. They live normal lives again. So in terms of quality of life changes, it's been tremendous. We are currently enrolling patients. You can start with an exploratory phone call just to make sure that they are visual snow patients who qualify for the study. So far, with my experience with visual snow patients, while they generally come in with very similar symptoms, when we do examination, the test findings are not the same for every single patient. So then when I design the therapy protocol, the treatment plan, I'm designing it based on their test findings and how do I make those test findings stronger and better. So as a part of the research that we're doing, we're also determining best clinical practices depending on what presents to us. So in this manner, it's not a one-size-fits-all type of therapy. It is a customized therapy for the patient's needs. The study is 12 weeks from the date of the first session, and as we're still enrolling patients, it's going to be at least another 3 months before the study is concluded. We're estimating probably June of 2021. Once we have findings from the study, we plan to share our findings. Our goal is really to help as many patients as we can, and we feel that the best way to do that is develop a really great protocol and then provide the information to local doctors. I believe the Visual Snow Initiative is going to hold a conference where we'd like to be able to share the information to anybody who attends the conference at that time.